It's really great.
So I want to welcome everybody to our Heal 2 talk. Heal 2 is health education, awareness, and literacy equals healthy engagement, actions, and life. Tonight we are recording, and I'll give a few reminders as we go along so that people do understand that we're recording if they come in a little bit later. Tonight we have Emily Moore, who's going to talk about HIV and STIs. It's from TMI to FYI, HIV, STIs, and infection prevention. And she's a physician at Brigham and Women's Hospital. So welcome, Emily. And before you get started, I'd just like to start a little poll. So I'm going to launch our pre-talk poll. And if you can answer the questions, and then we'll look at it in the post after the talk too.
All right. There's everybody. All right.
I don't see a poll yet.
No, neither do I.
Oh, you don't?
No.
I don't know how to problem solve that. Do you see it now?
No, not really.
Sorry, guys.
How many questions is in the poll?
There are 3 questions.
Can you just ask the questions and we just take a poll from there and to circumvent it because of so that we can get it done?
If people feel comfortable. The first question is, I can list and describe the most common sexually transmitted infections. The answers are yes, somewhat, and no. And it looks like 4 people have taken the poll, but
I'm going to say no.
okay. I'll add you to it. The second question is, I understand treatments for the most common sexually transmitted infections. Again, yes, somewhat, and no.
No.
And the third question is, I would be comfortable talking to a partner about STIs. The first answer is yes, the second somewhat, and the third no.
Yes.
Okay. Going to end the poll, and it looks like of the 4 that were able to answer it, 1 said yes to the first question, 2 said somewhat, and 1 said no. So if we add you, it was Ted that 2 would say no. I understand treatment. No one said yes. 3 people said somewhat, and 1 said no. And I would be comfortable talking to a partner. 3 said yes, and 1 said somewhat. Let's see. Okay.
That shows the importance of tonight's subject.
Yes, exactly. So I also like to introduce Dr. Liao, who's going to help monitor the chat. If you have any questions, feel free to put them in the chat. And maybe about halfway through the talk, we'll just take a little pause to see if people have questions, or if you want to break it up differently, feel free to, Emily, and we'll take it from there. So I'll turn it over to Emily. Thank you very much.
Okay, great. Thank you all for coming. This is sometimes a hard topic to talk about. It's sometimes uncomfortable, and I feel like it's one that people sometimes struggle to talk to other people about and talk to their doctors about. And so hopefully, my hope is that this can be a safe space to ask questions, or at least to kind of share information that you may not know before, and then hopefully kind of have some phrases and in the toolkit in case they're needed, because sometimes I think finding the words to talk about these things can be one of the hardest things. So what I'll do is share my screen. Mandy, I think you'll have to enable screen sharing for me. If you make me a co-host, then that will work. Great. All right, perfect. All right, perfect. So this is about HIV and STIs, and I have no disclosures. I have to say that. Maybe someday I will. And then, so our goals are to talk about the most common STIs: HIV, syphilis, gonorrhea, chlamydia, herpes, and HPV. And as well as talk about different types of treatment for each of these kinds of STIs. And then talk about how to protect ourselves from STIs, as well as how to talk to partners about them. So the first thing to say is that STIs are very common. 1 in 5 people in the US have an STI at any given point in time, which is a lot of people. And the rates are increasing year to year. And particularly high-risk groups are young people, usually people under the age of 25, men who have sex with men, and non-Hispanic Black folks are groups at higher risk. And there's a bunch of reasons for this, a bunch of theories about why this might be, and we can definitely talk about that if folks are interested. I think one reason is that prevalence rates are just higher in those folks. And so even if somebody is not actually sexually active with that many partners, just because the rates are higher in those groups, it's a higher risk of getting an STI. And so literally, how does somebody get an STI? It's, very plainly, it is sexual contact with the infected area. And it really can be whatever part of the body comes into contact with the infected area. So usually it is the genitalia, but it can also be the mouth. It can be whatever other body part comes into contact with it, including the hands, etc. for some of these. It can also be spread congenitally. And what that means, it can be spread from a pregnant mother to a fetus. And I think the other important thing to say is it can actually be spread by somebody with no symptoms. And we'll talk about this, but that's partially why always being mindful of, being tested regularly, knowing what your partner's testing status is, and making sure you're using protection like a condom is extra important. So this chart basically talks about the number of new infections, as well as the number of total existing infections at one point in time during, I believe it was 2018 was when what this data is from. So the most common STI is HPV, human papillomavirus. So 43 million people in the US have HPV, and then there's 13 million new infections every year, which is a lot. And then HSV2 is herpes. And so this is about 500,000 new infections every year. And then trichomonas, there's 7 million new infections a year. Chlamydia, there's 4 million. Gonorrhea, 1.5 million. HIV, about 30,000. And then Hep B, and then syphilis. So we'll go through not every single one of these, but most of them in a little bit more detail. But all that is to say, the gist is that there's a lot of STIs. They're very common, and so it's worthwhile talking about them. So HPV, human papillomavirus. So like I said, this is the most common STI. And almost everybody who is sexually active at any point in their lives will get HPV. This chart is nice because it goes through the different ways that HPV can show up in our bodies. So it's kind of, so we can start with this bottom one. So low risk, so there's a bunch of different types of HPV. And the very low risk types of HPV, we are able to get rid of that by ourselves. Our immune system is able to clear it. If it's a lower risk type of HPV, it may be hard for us to clear it, but it doesn't cause anything dangerous, but it can cause genital warts. HPV is the virus that causes genital warts. And then the high risk HPV strains are actually associated with causing cervical cancer, is the biggest one in women, as well as some other cancers of the genitalia, like anal cancer, vaginal cancer, and then vulvar cancer, which is part of the genitalia. And it's, we can't predict which type we will get. And so that's partially why prevention is really important. So the HPV vaccine is something that usually teenagers get. Sometimes if for the older folks out there, you won't have gotten this when you were a kid, because it's on the newer side. Right now, it's Gardasil is the common name that you might have heard of it as. And right now it's approved for people actually as young as age 11. And usually we try to give it to folks age 11 to 26. And the reason for that is it's good to get the vaccine ideally before somebody has the chance to get HPV. And you can get HPV even with your very first sexual partner. And in some people, in some groups, it's actually approved up to age 45, but this becomes much more of a discussion, an individual discussion with your doctor about whether this would make sense for you. Because as you get older, chances are you've already been exposed to HPV if you've been sexually active. And so the vaccine just becomes less helpful. And then over and over again, we'll say this, but condoms are the only way to prevent HPV. Although it's not 100% because it just depends on what body part touches what infected body part. And as we know, condoms only cover a limited real estate area. And so in terms of detection, so there's not a good routine test for all comers for HPV. Pap smears do detect HPV. And so Pap smears are for women/people, anybody with a cervix. And they detect the HPVs that are the high risk for cancers. They don't detect all comer HPV, but they detect the HPV that's a cancer risk. And that's important to know because it needs to be monitored much more closely. But there's no routine test for HPV. And part of that is because a lot of people will clear it on their own, and it's hard to know it's impossible to know, in fact, who will be able to clear it on their own. And treatment-wise, there's no specific cure for HPV. If something manifests as genital warts, if something manifests as a cancer, there are specific treatments to those things. But unfortunately, since it's a virus, there's no way to get rid of it from our bodies. So that's the main stuff for HPV. I'll pause there and see, does anybody have any questions about HPV specifically? You can type it in the chat, unmute yourself, whatever feels comfortable. Okay, totally great. If anything comes up at any point, just type it in the chat. Okay, so next up on our list is gonorrhea and chlamydia. So gonorrhea and chlamydia, I grouped them together because they present quite similarly in terms of the symptoms, and we often treat them together because they often happen at the same time. They're both kinds of bacteria And this nice chart on the right, again, it's labeled as gonorrhea, but chlamydia presents basically the exact same. For men and women, there can be discharge. It can be green, it can be bad smelling from the penis or the vagina. And then you can have burning or pain with urination. Women can have bleeding or spotting between their periods, and that can be from inflammation of the cervix. And then men, less commonly, but still possible, can have swelling and pain of the testicles. And then for folks who engage in anal sex, you can also get rectal infections with discharge and bleeding as well. So this is important to know about, because if this can be treated with antibiotics, we can get rid of this. Unlike HPV, we can treat this, but it's important to treat because women or people with cervixes can actually have very serious long-term consequences sometimes. And the reason for that is the infection can, instead of just staying more towards the outside where the cervix is, sometimes it can actually go further into the body and sort of go up into the uterus and out to the ovaries and cause a lot of inflammation and scarring. And the risk for that, you can actually have infertility. You can have something called pelvic inflammatory disease, which is just a much more significant disease with a lot of abdominal pain. You can get abscesses, like collections of bacteria and infection, and it just overall can be much more serious. And then one thing to say about gonorrhea, that's something that is emerging ongoing. We still have good antibiotics to treat it, but it's a very interesting bacteria, and it's actually prone to antibiotic resistance. And so they're not terribly common, but there are some really nasty strains of gonorrhea out there that are actually becoming pretty hard to treat with antibiotics. And gonorrhea also has a risk of blood infections, so you can become more sick, more so with that than chlamydia. And then prevention, as with everything, condoms. And detection for this, so we can screen for this. Remember, with HPV, we only screen for the high risk strains with pap smears. With gonorrhea and chlamydia, but we actually recommend screening everybody, all women, once a year under the age of 25 for this, just because of how common it is. After the age of 25, it becomes more of a discussion about risk factors. You know, if somebody has had multiple recent sexual partners, if somebody has new symptoms, or if somebody is about to become sexually active with a new partner and just wants to, know what their status is, screening can definitely be done. It's more important. Generally, we talk about routine screening in women more so than men, interestingly, but certainly it's valid to screen both, especially if somebody is interested and is at risk and wants to know their status. And the way we screen in men, it's just a urine sample. It's very easy. And then in women, you can also do a urine sample. The best is a vaginal swab. And I'll say this is more for gonorrhea than chlamydia, but also you can get gonorrheal rectal infections and throat infections. And so ideally, clinics will do 3-site swabbing. So swabbing the genitals, swabbing the throat, and swabbing the rectum if all of those sites are involved in sexual activity. So I'll stop there for the gonorrhea and chlamydia. Questions about that or anything that's coming to your minds?
There is a question in the chat. Can you contact this while in the public?
Oh, you mean contracting gonorrhea and chlamydia while in the public? It's a good, correct me if that is not the question that you meant. That's a good question. Generally, no. And the reason for that is it's really transmitted with bodily fluids. It's not something like the common cold that is just transmitted via saliva or touching things like that. It's really related to genital contact and those sites of exposure. So it would be challenging to contact this when just out and about in the public.
I have a couple of
Thank you.
quick questions.
Yeah.
Okay, so follow up from that. What about people who sit on toilet seats, public toilet seats? Can you, I mean, when they asked that question, I mean, that is what I thought of. Like someone sitting on a public toilet seat and you can actually, can you get it that way? That was my first question. And the second one is with the discharge and burning that you mentioned from those two, are they anywhere similar to, like, say someone getting a yeast infection or have a urinary tract infection where they might be burning and also discharge, or is that completely different?
Yeah, those are two really good questions. I will say in general, and I'll actually give Daniel the opportunity to look up more specific numbers on this, but in general, we do not think of toilet seat or things like that as routes of transmission for this. And the reason is it's more important about contact between what we call mucous membranes. So genitalia to the mouth are the most important areas, and also, the anus and the rectum. And when you're sitting, the skin where you sit on your thighs and your buttocks is actually very tough in the sense of that there's no way for bacteria that's on the toilet seat to get through that way. The main ways that it gets into your body is through those mucous membranes, which are just much more vulnerable to bacteria, which is really the mouth, the anus, and the vagina, penis, the genitalia. So I'll stop there. What follow-up questions do you have on that? Did that answer what you were saying?
That answered, so then it would
Okay.
be just the other question that I asked.
Okay, totally. Yes. And so for the other question, it definitely makes sense. And you are totally right that some of the symptoms of gonorrhea and chlamydia, specifically the pain and burning with urination, those can actually look exactly like a urinary tract infection. And so that can be important because urinary tract infections are so common in young women, especially, that sometimes doctors don't dig much further in thinking about if it could also potentially be an STI like gonorrhea or chlamydia. And so in men, they're less common, and so it's more often thought of. A yeast infection presents a little bit differently. That has a lot of thick white discharge, and it's very itchy. So that looks a little bit different to us when we hear about those symptoms. But you are right; it looks very similar to a urinary tract infection, and so it's part of that is it's important for doctors to ask about those things. Ask about new sexual partners and risk factors, and have a high index of suspicion. But part of that too is me sharing with y'all to kind of have that in your minds too, as something that could be related.
I would like to add to Dr. Moore's comments, and I put them in the chat. I was doing some research. There hasn't been a study on this yet, but because bacterial infections that cause sexually transmitted infections, gonorrhea and chlamydia, because they cannot survive outside of an environment of mucous membranes, it makes it basically impossible for it to be transmitted because the seat itself is not a mucous membrane. That being said, we can't really study that with the trial.
Okay.
No, thank you, Daniel. That's very helpful.
But are there diseases that you can get from sitting on the toilet seat? I mean, I always imagine you must be picking up something, but are there any?
None that it is so significant a route that I talk to patients about it. I always hesitate to say it's impossible, but because we know that some things can be transmitted skin to skin, like some rashes.
Mm-hmm.
But in terms of sexually transmitted infections, it's less common. The only one, and again, Daniel and Dr. Liao, I'm curious what your thoughts are on this too, but in my mind, potentially herpes may be the only one, because that can be, that doesn't always have to be right on a mucous membrane. What do you think, Daniel?
It's
a tough question. It's a great question.
It's a great question. It's hard to answer. The formal tagline from the National Institute of Allergy and Infectious Diseases says that genital herpes is spread, quote, rarely, if at all, by objects such as toilet seats.
Yeah.
So I think we can't say never in that case. I would like, in terms of other regular sorts of infections, non-sexually transmitted infections, there have been some cases of it being spread, such as lice, which can be spread by any object, but they're a different kind of organism. They're parasites, as opposed to these organisms that Dr. Moore is referring to, which are bacteria.
Great. Oh, thank you, Daniel. That's really helpful. Okay. What follow-up questions to that? I know it's a very interesting question, and there's not always fully knowable, but a good question. Okay. Well, great. I'll keep going, but definitely keep thinking of questions. This is great. So the next sexually transmitted infection I did not finish gonorrhea and chlamydia. The most important part is treatment. So like I was saying, these are curable. These are bacteria, and so we can treat them with antibiotics. The most important thing for this to talk about is partner treatment. And so if you, for instance, are diagnosed with gonorrhea or chlamydia, you actually will need to tell all of the recent sexual partners that you've had. And the ballpark for this is about 60 days, a couple months before symptoms or diagnosis. And the reason for that is once you have symptoms, it's not fully clear how long you've had the bacteria, how long you've had the infection for. And it can actually be some time before symptoms present. And like I was mentioning before, some people don't have any symptoms. And so that's why the window of time is so long that we advise folks to disclose to all their recent sexual partners. And then once you get treated, it's important to avoid any sexual activity, including oral sex, until treatment is done and symptoms are gone. So that's at least a week. If symptoms aren't gone by then, it's still symptoms are gone. And then it's actually important to get retested 3 months after treatment, because every once in a while somebody can get reinfected, and then we'll need to get treated again. All right, so herpes. This is one I mentioned before. This is probably the most graphic picture I have, so don't worry. So herpes is a virus. It's actually the same one that causes cold sores, which are sometimes kind of a big sore spot right on the outer part of the lip. There's two main types of herpes viruses. The first kind mainly causes cold sores. The second kind mainly causes genital herpes, although sometimes the one that causes oral herpes can cause genital herpes. And so in terms of symptoms, again, it's similar to a lot of other STIs. Sometimes most people have no symptoms. Sometimes you'll have mild symptoms, and then the classic symptoms of herpes, which this picture shows, it's a group of these are very small blisters. These are maybe a millimeter or two. So this is very zoomed in, and they're on this background of red skin. And then you can imagine as these blisters grow and then eventually pop, it leaves behind this very painful ulcer. And it's quite painful, particularly because usually since they're near the genitalia, urination and wiping can be very irritating to them. And you can also have some systemic symptoms with herpes. You can have things like fevers. You can just not feel well. You can have some tingling or shooting nerve type pains at the site of the rash as well. And then the thing about herpes is, since it's a virus, there's no cure for it. And it can be pretty recurrent. If anybody's ever had a cold sore, you know, sometimes they keep cropping up. And especially in times of stress, or if you're sick otherwise, that can lead to an outbreak. It's more likely to spread when you have these active blisters or ulcers, but you can spread it even without blisters or ulcers. And as we were alluding to before, this one is not only on the mucous membranes. This one can be on the skin sort of next to the mucous membranes. And so this is one that you can get on your hands if you touch the lesion, etc. So it's not only in the mouth, anus, or penis, vagina. And then in terms of prevention, so the big one, although again, you can spread it when you're not actively having an outbreak, it's more likely to be spread during an outbreak. And so avoiding sexual activity during an outbreak can be helpful. Condoms are always helpful. They're much better than nothing. And then antiviral medicines. So the two that we think of are acyclovir and valacyclovir or Valtrex. And while these don't cure herpes, they can suppress it. They can, if you take it regularly, they can actually help prevent outbreaks from happening. Or if you are having an outbreak, taking antiviral medicines can help shorten the outbreak. So they can be very helpful medicines to use. And then in terms of diagnosing it, usually it's based on the story that the patient tells us and the symptoms that they tell us about. Because if I do a physical exam and I see that picture, that is herpes, and I don't need to do any sort of lab testing for it. Nothing else looks like that. You can swab one of those blisters, one of those lesions. It's quite painful. And sometimes we do it just to confirm the diagnosis, but frankly, we don't often do that. Even less frequently is we can do a blood test to check for herpes. This is less useful, and that's because it doesn't tell us when you've had herpes. Because once you've had it, even if it was a really long time ago, it can be positive. And sometimes if you do have herpes, these aren't always positive, or these antibodies don't always show up. So we don't often check these. And then, like I was mentioning, there's no way to cure herpes, but antiviral medicines like Valtrex or acyclovir can be very helpful in controlling outbreaks, which can be very uncomfortable. Okay, any questions about that? Or any thoughts, concerns?
So once someone has herpes, they always have herpes. So
Yes.
They basically should always tell some person they have herpes, even if they don't have an outbreak, because they really do, and it can happen anytime.
Yes,
right?
I agree. That is the best thing to do. And we'll talk about this a little bit more at the end when we talk about sort of, ways that you can disclose this to partners. But we do recommend that somebody with herpes disclose to their partner, because there is, even if you don't have an outbreak, there's always a small chance of transmitting it. What other questions? Great question. Okay. All right. Well, we will move on to the next one, which is syphilis. So syphilis is actually making a quote unquote comeback these days, which is not a good thing. And so syphilis is a bacteria. This is a fun picture. It looks a little bit like a cheese curl, but this is what this bacteria looks like. It's called a spirochete, which is named because it kind of looks like a spiral. And syphilis can look like a lot of different things. There are a bunch of different stages of infection. The classic one that starts off basically all cases of syphilis is this infected sore. And that's usually on the genitalia. It doesn't hurt. It looks like a little ulcer. And if you don't do anything about it, it will usually go away. But that actually doesn't mean the syphilis itself has gone away. It just, for whatever reason, won't last forever. And then the next, if that first stage isn't treated, syphilis can progress to a rash, which can look like a few different types of rashes, and a fever, and just generally feeling poorly. These two stages are where they're most infectious to other people, but you're really infectious throughout the process. After this, you can actually have a time where you don't have any symptoms. And then what we really worry about is late stage syphilis or tertiary syphilis. This can be fatal, and this can be deadly, and it can cause a variety of things like problems with your blood vessels, problems with your internal organs, and problems actually with your spinal cord and your brain. And so and again, I know I mentioned this before, but just because a stage resolves and the symptoms go away, the infection is not gone. And that actually, this is partially what makes syphilis really hard to treat, because symptoms come and go, and people don't always identify them. And so the best prevention for syphilis, again, is condoms, and not especially, similar to herpes, and not being sexually active with somebody who has any sort of active lesion is very important, at least until that goes away, or until they figure out what it is with their doctor. Detection, we do a blood test for syphilis. It's quite easy to detect. And then treatment, it's actually very easy to treat, interestingly. We still use penicillin, which is the oldest antibiotic. And for whatever reason, this syphilis doesn't have any resistance to penicillin. So penicillin has always worked. Hopefully it will always work. But at least for right now, it's quite easy to treat once we catch it. And that's all for syphilis. Anything else to say? Any other questions about syphilis? And this is one I will add. Some of all of these have issues with congenital transmission. So with a mother, pregnant woman to a fetus. Syphilis is one that can cause quite significant birth defects and problems for children. And so we screen all pregnant women for basically all of these sexually transmitted infections, but syphilis is one of the most important ones. And unfortunately, there was about 2,000 cases of neonatal, of infant syphilis born the last time, I believe in 2018, the last time they did a full accounting. And it's quite tragic, frankly. It really should never happen. And so this is a tough one for the public health system. And then HIV, so human immunodeficiency virus. So this is one that we all know this name, and we hear a lot about it. And so I think it's worth spending a little more time on it. So in terms of symptoms, early HIV can actually look a little bit like the flu. You can have lymph nodes, you can just feel generally fatigued and have muscle aches and have a sore throat. And so that in that stage, it can be quite tricky to diagnose, because since it does look like just a normal flu or upper respiratory infection. And so at that, it's good to have a high sort of index of concern. If you've had new recent sexual partners and then this happens, important to keep up on screening and to kind of share that with your provider. Chronic HIV, once you're past this early stage, people actually don't have any symptoms and can do well for a really long time, for years to even decades. And then late HIV is what is known as AIDS, which is acquired immunodeficiency syndrome. And this is what kills people. And so this is when your immune system is so hurt by the virus that it really isn't able to help you anymore. And this is when people get really severe infections, and typically they will pass away from them. It can also make you more prone to getting certain types of cancers too. And interestingly, having another STI increases your chance of getting HIV. And so that's another reason why it's important to be really on top of screening and kind of sharing all of these symptoms with your providers throughout. The reasons, there's a couple reasons for that. One of them is HIV is a blood-borne virus. And so it's transmitted through blood, not just mucous membrane contact. So kissing does not transmit HIV. It does not transmit HIV. However, if you're sexually active with somebody who, for instance, has one of those ulcers on their genitalia from syphilis, then there is a chance, of the HIV getting into the bloodstream through that way. It's sort of like a portal of entry, if you will. And we know that, especially for folks who practice anal sex, which is often men who have sex with men, but not always, that can happen in heterosexual partnerships too. The rectum is just it's just not quite as pliable as the vagina. And so you can get these little sort of micro tears or micro perforations. And that way, HIV is able to access the bloodstream, which is one reason why in the community of LGBTQ men, HIV was such an epidemic. And I just wanted to put up this slide because I think we know this a little bit more now, but especially when HIV was first coming on the scene, folks with HIV were very discriminated against. And this was a very stigmatizing illness to have. Many folks with HIV were ostracized and just really excluded from society. And part of that was just folks not really knowing how HIV was transmitted and thinking, oh, if I shake somebody's hand with HIV, will I get HIV? The answer is no. So HIV, like I was mentioning, it is blood-borne. It can also be transmitted from a pregnant mother to a child, both in utero when they're a fetus and actually with breastfeeding. So in this country, we recommend that mothers with HIV bottle feed their babies. And then unprotected sex, blood transfusions, and then some medical situations like non-sterile tools and organ transplant can transmit it. It is not transmitted just by sharing food, by kissing, like the saliva I mentioned, not transmitted via toilet seats or showers, and then not transmitted via mosquitoes too. And then this last part of HIV, in terms of prevention, so condoms, as always, can help reduce the risk of getting HIV. But these two, PrEP and PEP, are really interesting. And if folks are interested, I can talk a little bit more about this at the end, but this has really come on the scene in the last few years. PrEP stands for pre-exposure prophylaxis, and this is indicated for folks who are at a high risk of getting HIV. And basically it's a medicine. It's one pill that you would take every single day. It's in the group of medicines that treat HIV, but it's a little bit of a different kind of combination. And if you take it every day, it actually reduces your risk of getting HIV by like 90% if you are somebody that's at high risk of getting it. So for instance, some high risk groups are folks who inject drugs, folks who are sex workers, men who have sex with men, folks who have multiple partners, whether it's of the same gender or different genders. Those are folks for whom PrEP can be life-changing for. And just to note, PrEP only prevents HIV. It does not prevent other STIs. And so ideally, somebody who is sexually active with multiple partners would use PrEP and a condom to prevent all STIs. But it's just a really, really nice extra layer of support. And then PEP is post-exposure prophylaxis. So this comes into play, for instance, if somebody works in a hospital setting and has a needle stick injury, or is assaulted and needs to take this afterwards to be safe, or if somebody has a a weekend where they slept with multiple partners and were not without using protection. Those are examples of folks who may be candidates for PEP. And so it's very interesting. And there's a new medicine recently, a few new medicines that are kind of coming on the market for PrEP especially. And it's very exciting. And then detection of HIV, it's a blood test. It's quite easy. And then treatment, there's no way to cure HIV, but the medicines we have are amazing and life-changing. And HIV, if antiretroviral medicines are taken regularly, HIV can be as well controlled as diabetes. It can be just another chronic disease, which is a pretty remarkable achievement of the past couple decades. So I'll stop there. Any questions about HIV?
We have a question in the chat. Can pets contact these diseases?
That is a great question. Daniel, I'll enlist your help in looking into this. One thing I know about is there's a HIV equivalent in cats called FIV, feline immunodeficiency virus. And so while I do not believe, and Daniel will help support this, but I don't believe that HIV can be transmitted to cats or pets in general, but my understanding is that there are some equivalents.
That was an excellent question and response. I frankly had no understanding of that. On reviewing some literature, it seems like they can get some sexually transmitted infections. They often are, as Dr. Moore mentioned, analogous to our diseases, but different. One that stands out as something that is similar in both types of species would be herpes, the herpes virus. And I don't see any particular data on transmission from humans to pets through some sort of contact. But that, yeah, so in short, don't know.
Yeah.
But of all of them, herpes seems to be in both types of populations.
Mm-hmm. Yeah, thank you, Daniel. What other questions? We'll keep doing a little more digging about that too, but what other questions about anything? Okay. And then a couple other ones that can be sexually transmitted that I won't talk too much about today, just for time considerations, is hepatitis C and hepatitis B. These more classically we think about as bloodborne infections and are not always transmittable sexually, but are possible. And then trichomonas is one that presents similarly to gonorrhea and chlamydia. It can present with spotting in between periods. It can present with some vaginal or penile discharge. And so it's a similar approach to gonorrhea and chlamydia. And usually what is done is in the clinic, a pelvic exam would be done and swabs would be taken of the cervix to test for this. And so the biggest kind of to wrap up, to talk about how to avoid getting an STI, the big one is condoms. And so just to talk more concretely about condoms, and some of this potentially you may know intuitively or may make sense, but just to say it explicitly, because it's not always explicit. So birth control only prevents pregnancy. So things like IUDs, oral contraceptive pills, those things only prevent pregnancy. Condoms are the only things that can prevent both STIs and pregnancy. And like I mentioned before, PEP and PrEP can prevent specifically HIV, but not other STIs. And so using condoms correctly is actually important. And this is not really something that's often talked about, so I just wanted to name it. So condoms can expire. And if they expire, they don't work quite as well. There's a risk of them ripping or being dry and brittle. And in that case, don't use them. New ones are better. And then the other thing is there are natural or animal skin condoms. Those can prevent pregnancy, but they don't they don't work quite as well, and they are not as good as the latex or polyurethane ones at preventing STIs, just because the barrier is not as complete. And then in terms of fit, it should be snug, but not too tight, just to strike a balance between not breaking and not sliding off. And then female condoms do exist. They're not quite as common, but they're a little bit harder to place and confirm placement, but they go internally into the vagina. So those do work, but usually we focus on the male condoms. And then if a condom breaks during sexual activity, get tested for STIs in pregnancy. And then, as I mentioned, other ways to avoid STIs, HIV, PrEP, herpes, we can use suppressive antivirals, not to 100% effect, but to pretty good effect. If sex toys are used, clean them between use, because things like gonorrhea and chlamydia can be transmitted with toys. And then talk to your partners about being tested, which is what we're going to talk about to finish up the talk. So any questions about what I've just said before we finish up?
I think I have just a quick question.
Yeah, of course.
What is exactly the difference between the infection versus disease? Because growing up, it was always STDs, and then they changed the narrative and said they're STIs. So what was the difference for that? Like, what would it be an infection, not a disease?
Great question. There is functionally no difference. I think that the reason is that STDs potentially was starting to feel a little bit sort of pejorative and a little discriminatory, and STI was thought to be a little more medical. It's like, you're diseased, this is bad, versus like, it is an infection. But it is the same thing functionally. So you can use either and it's correct. Good question. What other questions? Okay, great. So this last part is to talk about what if your partner has an STI. So the first thing to say is I try to avoid any knee-jerk reactions and try to avoid blaming them. And I say that because it feels very normal to feel betrayed if your partner discloses an STI to you. But remember that many people don't know when they have STIs. And so it does not mean that they're cheating. It doesn't, it does not necessarily mean those things. It may just mean they didn't know that they had one, not that they were necessarily intentionally exposing you or cheating. And so just to go through some specific things to certain STIs. So if your partner has HIV, things to know, firstly is U equals U. And so what that's sort of a phrase that's been used over the past few years. And what that means is undetectable equals untransmittable. And so if somebody has HIV and their viral load, which is the number of HIV viruses that are going around in the bloodstream, if we can't detect any HIV viruses on a lab test, then they are quote unquote undetectable. Then that means they cannot transmit HIV to somebody else. And so what that means if somebody is taking their antiretroviral medicines, if they're undetectable, their partner will not get HIV. And so that situation is, that's one situation. And then otherwise, still important, using a condom and using PrEP, we've talked about. And then if your partner has gonorrhea, chlamydia, syphilis, which are the 3 bacterial sexually transmitted infections, the most important thing is to make sure that you get treated and avoiding sexual contact for at least a week after you both are treated and until symptoms have resolved. If your partner has herpes, so with an active lesion, it's best to avoid sexual contact because the risk of transmission is higher. If they don't have an active lesion, remember it's still possible to transmit it, although it's less likely. Using a condom prevents it as much as possible, but just know it is still possible to transmit it. herpes is not something that is lethal. It's not fatal. It can be painful and very annoying, and people can feel a sense of stigma when they have herpes. But herpes itself it's not as bad as some of these other STIs in terms of harm to the body. If your partner has HPV, again, this is a little tricky because you've probably seen or been exposed to HPV in the past. You may or may not be immune to whatever strain that they have. It's impossible to know. And so using a condom is safe and is usually what we recommend. And then sort of things to say to your partner. So those were considerations for if your partner has a STI. And so now thinking about things to talk to your partner about related to STIs. So if you are getting involved with a new partner, ideally it's good to talk about this sort of before you become sexually active, because once the moment, quote unquote, is there, it becomes very hard to sort of stop things and have this conversation. So it's good to talk about it ahead of time. And this can be hard to bring up. Usually a phrase or just a short thing to say that often goes over well is to start by letting them know that you've been tested, because that comes across, that may be easier for you to share. You could say a phrase like, hey, I just wanted to let you know, I just went to my doctor. I got tested for STIs, and I have, a clean bill of health. And I was wondering if you've been tested recently. And if the answer is no, I would say don't feel shy about asking them. Say, would it be okay if you got tested? I would feel more comfortable. And then would otherwise using a condom until you both have been tested would be the recommendation. And again, just to say, it's not about a lack of trust. It's possible to have an STI from a prior relationship and not know about it. It doesn't mean somebody's been cheating, and it actually can be hard for somebody to disclose this to you. And so just to sort of not avoid the knee-jerk reaction of blame and sort of hear out your partner and go from there. And then the flip side is if you have an STI. So remember, STIs are very common. Remember that statistic right at the beginning, 1 in 5 people in America at any given time have an STI. It is very common. The right thing to do is to disclose. And a lot of that is putting yourself in somebody else's shoes and thinking, I would want to know if my partner had an STI so that I could make an informed choice and that I can protect myself, to the extent that I feel comfortable. I would say wear a condom until you're able to talk about these things with your doctor. This website here, it's a CDC affiliated website, and it has a lot of really good resources, which is why I included it there in case anybody is interested in looking it up. But sort of a sample phrase that they use was, for instance, about herpes is, so, hey, I just wanted to talk to you about something. Last year I was diagnosed with herpes. This is, a virus that causes cold sores of the mouth, but I have, a rash down there, quote unquote, or on my genitals. And I just wanted to let you know, because I want to be really honest with you. And so that, you can feel comfortable and we can figure out how to, how you can feel comfortable and how, we can be safe going forward. So that's all I got. What questions do you guys have about anything I've said? I know this was a lot, and I know it's sometimes hard to talk about this stuff, which is partially why I wanted to talk about it, because I think it's important.
2 quick questions. I'm
Yes.
sorry, I have all these questions.
Oh my gosh, no, but, I love it.
the T one, I can't remember the name. Is that a bacterial one too that can completely go away, or is that one like herpes that never goes away? The one begin with T, tricho something?
The trichomonas, great question. Yeah. It's one that can be cured with an antibiotic.
Oh, okay, so herpes is basically the only one except for the HIV where you kind of like have it and you keep it?
Yeah, great question. So yes, so the other ones, so gonorrhea, chlamydia, syphilis, trichomonas, and hepatitis C these days can all be cured. The viruses cannot be, except for hepatitis C. So HIV, HPV, herpes, and Hep B do not have cures right now, but can be treated by some medicines.
Right. And the second one is, I've heard that STIs are rampant in nursing homes. Like, is there more being done about nursing homes? Because I hear that goes on a lot.
That is such a great question. I was talking about this with somebody the other day, and I do not know what exactly is going on at nursing homes, but I agreed with you that I don't think it's enough. And I think part of that is the fault of doctors, because I think we think a lot about STIs in young people, perhaps rightfully so, because the rates of STIs are highest in young people. But exactly like you say, there are a lot of STIs that happen in older folks. And so I really think that it's incumbent upon physicians to become more open-minded and more routine in who they ask sexual history questions of. But as to this more specific question, I don't know specifics about the stats or any interventions. Daniel may be able to help with that. But any other thoughts, any other questions?
I have a comment. Given this pandemic, it would seem like because we're taught distance, that there would be less sexual activity going on, but it seems like there's more going on. Is there something to support that?
That's a good question. I don't know the statistics around that. Perhaps Daniel, you may be able to find something. That's a good question.
Recently looking this up, I think data is still being collected for the past few months, of course, but during the early months of COVID, for sure, there was a decrease in sexually transmitted infection diagnoses. So the caveat is these have to be diagnosed. And I guess over time, if fewer people are going to doctors, then fewer things are getting tested in general. So you will find fewer infections. But I know for a fact, at the earlier stages of COVID, there were fewer diagnoses. And then as things started opening up again, as people were starting to see doctors, and as people were having probably more sexual partners, then that did increase. I'm not quite sure where it settled out, but the idea of diagnosing something versus having something is kind of two separate entities that is very interesting to think about.
Thank you.
What else? What other questions? Okay, well, if no other ones, at least now, I'm sure Mandy, if anything comes up, you can email Mandy and she can get in touch with us, and we would love to hear from you to answer whatever we can. Otherwise, I'll turn it over to Mandy.
That was great. Thank you very much, Emily. And I'd be happy to share any questions that anybody has with Emily, so we can get answers for you. I am going to bring up the poll again and see if we can do. Okay, this is the post-hoc poll.
Oh, okay.
And I did learn, I checked, if you're using certain platforms, you may not be able to get the poll. But hopefully people can see it now.
I can see it now.
Okay.
Yes, I can also.
I think you must answer question 4, the untitled question, to be able to submit it.
Okay, I'm sorry, Daniel. What did you say about the untitled question?
I think you have to click one of the options. I don't know what it represents, but or else it won't let you hit submit.
Oh, okay. So just click on one of them so you can submit. Okay. All right, sure. All right, now I can submit. Thank you.
Give it a few more seconds. Okay, I just ended the poll, and I'll share the results here. I can list and describe the most common sexually transmitted infections. Yes, 88%. That's great. That's a big increase. Somewhat was 1 out of 8, and no one said no. That's fabulous. I understand treatments for the most common STIs. 5 said yes, and 3 said somewhat. And so if you do have any questions, feel free to send them along and we'll share them with Emily so she can, so Dr. Moore can answer them. And then the third one is, I would be comfortable talking to a partner about STIs. 7 people said yes, and 1 person said somewhat. And, oh, sorry about the untitled question, that snuck in there somehow. And then the last one is, how did you hear about this? So we do have a variety there. Okay, thank you very much for answering, everyone, and thank you for participating. Thank you very much. That was a wonderful discussion, Emily, Dr. Moore. And next, we may have one in 2 weeks on how to de-stress during the holidays with your children. We're trying to get that together with a social worker and a trauma-informed yoga instructor. And then we'll have some resources for what to do with kids over the holidays that are free or very, very easy to get to in this area to entertain kids. And then we definitely have one in January on the 6th on hypertension. So emails will be coming out on that, and stay tuned. Thank you very much for joining, everyone.
Thank you for doing this, Ava. This is outstanding.
Thank you, everyone. This was great.
Good night.
Good night.
Good night. Thank you.